Good day, ma'am, and to each and everyone. So my name is Eliza Cristopo Ferros from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform return demonstration in regards of assessing the skin, hair, and nails. So prior to performing this procedure, we are going to, of course, perform hand hygiene or hand washing and don our PPE if there is necessary. So I have here an alcohol that serves as my sanitizer. So it is important also to prepare all the equipments needed for the assessment. And next, I'm going to proceed with the assessment proper. Hi dear ma'am, good day. How are you doing?
I'm great. How about you, ma'am?
Okay, that's great to hear. I'm doing good. Thanks for asking. So by the way, my name is Eliza Cristopo Ferros and I'm your student nurse for today. So can you please confirm to me your name as well as your date of birth, please?
Fair Parcon Cofreros, November 6, 1971.
Okay, thank you for that, ma'am. So what would you like me to call you? Is it by your first name or your last name?
First name, please.
Okay, thank you for that, ma'am. So the first thing that we need to do is to identify our patient. So this is to ensure that we have the right patient in front of us. And then it is important for us to establish rapport and introduce ourselves to our patient. So the next thing is if there is any curtains or doors within the area, it is important for us to close it in order for us to provide privacy to our patient. Next is I'm going to explain the procedure to my patient. Okay, Ma'am Fe, so I'm here to perform the assessment of your skin, hair, and nails. So why do we have to do this? So this is to ensure that everything is normal. If there is any abnormalities in your skin, just like skin discoloration, skin lesions, and in your nails, there is an occurrence of clubbing, as well as in your hair, there is a hair losses. So we need to take note all of them in order for us to prevent further complication. Do you have any questions with that, ma'am? Any clarifications?
Nothing.
Okay, thank you for that, ma'am Fe. So if you do have any question all throughout the assessment, you do have the freedom to do so, okay?
Thank you.
All right, thank you for that. So after we explain the procedure, we are going to remove the patient's clothes and replace it with the examination gown. So I have here a laboratory gown, which as an alternative for the examination gown. Okay, ma'am. So I will put this examination gown to you. Alright, so it is important for us to expose only the parts that we are going to examine. So the next thing that we're going to do is to proceed with the first procedure, which is what we call inspection. So what are we going to inspect? We are going to inspect the skin of our patient if there's any discoloration. Okay, Ma'am Thai, so may I invite you to please raise your hand just like this? Alright, thank you for that. So what I'm looking here is there is any signs of pallor, any signs of cyanosis, any signs of jaundice, which indicates abnormalities in the skin of our patient. So as I am inspecting the skin of my patient, there is no signs of abnormalities. She has a light to deep brown color, which indicates that is a normal color. Thank you for that, Ma'am Fe. Alright, so the next thing that we're going to inspect within the skin of our patient is we are going to check if there is an occurrence of skin lesion. Okay, Ma'am Fe, so may I ask you again to please raise your hand just like this? Alright. So what I'm trying to look here or inspect if there's any scratch, any insect bites, or any signs of bruises, or any skin lesions. Right? So as far as I'm inspecting, everything is normal and that is good. Thank you for that, ma'am.
Welcome.
Right. So if there is, so what do we call by the skin lesions? So skin lesions can be a primer. This is what we call macule and papules. So it can be secondary. We have the pressure ulcer and fissure, and it can be vascular, which we have the hematoma and angioma. And in worst scenario, it can be a sign of skin cancer, just like malignant melanoma. So if there is any signs of skin cancer, we need to evaluate it using the ABCDE pattern. So we have the A for asymmetry, B for borders, C for its color, D for its diameter, and E for its evaluation. Okay, so if there is a skin lesion on our patient, we are going also to check or take note for its shape, size, color, and texture. So we are done inspecting this, the skin of our patient. So the next thing that we're going to do is to inspect the scalp as well as the hair of our patient. So before doing so, we are going to don our gloves. Alright, and we're done donning our gloves. Okay, so Ma'am Faye, I'm going to inspect now your scalp. So may I request you to lower down your head just a little bit? Okay, so what I'm inspecting with the scalp of my patient. I'm looking here if there is any abnormalities, just like a skin lesion, skin breakdowns, or any flakings on the scalp of our patient. Okay, so as I am inspecting with on the scalps of my patient, there are no abnormalities so far, and that is good. So the next thing that we're going to inspect is the hair of our patient. So in inspecting the hair, we are looking here for the amount and distribution of hair. If there is a abnormalities, which is what we call hair losses, or any abnormalities in the texture of the hair of our patient. So as far as I am observing or inspecting the hair of my patient, therefore there is no signs of abnormalities, and she has a white some white color on the hair of she has a white color on her hair, which indicates that which indicates a sign of getting older. Right, so after we are done now inspecting the hair as well as the scalp of our patient, so we are going to remove our gloves and dispose it into the trash bin. Okay, so the next thing that we're going to inspect is the nails of our patient. Okay, Ma'am Faye, may I request you again to raise your fingers just like this. Alright, thank you for that. So what I'm inspecting here, if there is abnormalities, just like a nail clubbings, blue lines, or nail cracks. Okay, so as far as I'm inspecting my patient's nail, she has a normal nails, and she doesn't have any signs of abnormalities. So she has a good hygiene. Ma'am, you do have a good hygiene, and you do keep it up, okay?
Thank you.
Alright, you're welcome. So after that, we are done inspecting the nails of our patient. We are also going to inspect the capillary refill on the nails of our patient. Hey, may I request you again, ma'am, to check, to raise your hands like this. Right, so I will put the other one here, okay? So in checking the capillary refill, we are going to check it by pinching the nail of our patient. Okay. So if the color of the, while pinching, if the color of the nail returns into normal color, therefore it has a fast refill. And if we pinch it and it doesn't go back to the normal color for at least 2 to 3 for greater than 2 to 3 seconds, therefore it has a slow refill. So thank you for that, ma'am. So as far as I'm inspecting the capillary refill of my patient, she has an fast refill on her capillary nail bed. And it is important for us to remember that the slow refill indicates the signs of respiratory and cardiovascular disease, which can lead to hypoxia. Okay, so we are done now inspecting the hair, the skin, the scalp, and the nails of our patient. So the next thing that we're going to inspect is the odor of our patient. So as I am inspecting her a while ago, I also inspect her odor, and she has no occurrence of abnormalities in terms of her odor. So everything is normal. So the next thing that I'm going to do is to do the procedure of palpation. So in doing the palpation, we are going to palpate first the temperature. So I'm going to use the back of our hands because this is more sensitive to temperature. Because our fingers and palm has a thicker skin and it has a higher blood flow, hence they are less sensitive to temperature. So therefore we are going to use the back of our hands or the dorsal part of our hands. Okay, Ma'am Fe, I'm going to put my hands on your face. Would that be okay? Check your temperature.
Sure.
Okay. So what I'm trying to feel here is if there is any signs of fever, shock, or infection. Okay, so it looks like that my patient has a good normal temperature because she has a warm temperature, and that is normal. Okay. So if our patient has an open skin, we need to don our gloves to avoid the contamination and infection as well. So the next thing that we are going to palpate is the texture and the moisture of the skin of our patient. So in assessing the texture and the moisture, it is important for us to remember that the moisture in the skin folds in our axilla are normal, but excessive dryness and excessive moisture is a sign of this abnormalities on this moisture and texture of our patient. Okay, Manta, so let me check your hands again. Alright, so as far as I'm assessing the skin of my patient, there are no signs of abnormalities, which is good. Thank you for that, Ma'am Fred.
Welcome.
Alright, so the next thing that we are going to assess is the texture as well as the skin turgor of our patient. So how do we palpate this? So we are going to expose first the clavicle of the skin of our patient below her clavicle. Okay, Ma'am Fred. So I'm going to lower down your lab gown, your examination gown. Okay. So in inspecting for the skin turgor, we are going to pinch the skin at the lower part of the patient's clavicle. So this is our patient's clavicle over here, and we are going to pinch it. Right. So in order for us to check for the skin turgor, if we pinch it and it doesn't return into normal position, therefore there is a presence of skin turgor. So if we pinch it and it backs into normal position, therefore there is an absence of skin turgor. Okay, so as I'm inspecting my patient's skin turgor, there are no signs or there are absence of skin turgor, which is normal. Okay, so the next thing that I'm going to palpate is for edema. So we are going to request our patient to raise her feet on our bed. Okay, Ma'am Fred. So I'm going to lift your feet over here. Okay, to check your Okay. So why am I requesting the patient to raise her leg or foot? So the area of the feet, the area of the legs, ankles, the hands, and the abdomen is where the area where we assess for the edema. Okay, so as we assess for the sign of edema, we are going to apply pressure on the legs of our patient. And if it remains indented, therefore there is a sign of edema. And if there's no indentation or it brings back, if apply pressure and it go back into normal position, therefore there are no signs of edema. Okay, so as far as I am assessing my patient's leg, there is no sign of edema. Alright, so Ma'am Fe, I'm going to assist you again to go back. Thank you for that. Alright, so after checking or palpating for the sign of edema, that is the last thing that we're going to do in palpating or for the assessing of skin, hair, and nails. So we are done assessing all of them. So after we end, we are going to sanitize our hands first. And we also provide care to our patients after we leave. Okay, Ma'am Fe, so I'm going to remove your examination gown.
Thank you.
Alright, so we are done assessing your skin, hair, and nails, okay?
Thank you, Ma'am.
You're welcome. And after we assist the patient and sanitize our hands, we are going to document all the findings or results of the assessment of the hair, skin, and nails of our patient. So thank you, and you do have a great day.